Hello everyone, thanks again for watching another one of my videos. I'm Dr. Michael Sistare with Palm Beach Cosmetic Surgery. If you've seen other videos of mine, you've seen that I talk about a variety of different topics. One of the topics I talked about was liposuction. And even though when you think of liposuction, you think of contouring a woman's body, liposuction for men is definitely an option because men have the same cosmetic issues that women have, but in different locations and with certain considerations. Some of the common areas that men pursue liposuction in is for love handles and for the fat that accumulates on top of the chest, right here. So the fat that accumulates on top of the chest is called gynecomastia. When that tissue is made purely of fat and not any breast glandular tissue, it's called pseudogynecomastia. The reason you make this distinction is because they're treated a little bit differently. If it's just fat sitting on top of your chest, that fat is amenable to liposuction. So if it's glandular tissue that sits underneath your chest, then the liposuction technique isn't very good at getting rid of that glandular tissue, and that warrants direct excision of that tissue, and it's not going to come out with a cannula. Another area that men pursue liposuction in is love handles. Men tend to put on weight right around their midsection, specifically on their lateral lower back. Even if you lose a lot of weight, myself included, what you've noticed is the fat tends to accumulate right on the outer aspect of your lower back, and sometimes that, when you look at yourself in the mirror, you notice that little bulge right at the bottom, right above your hips. It can be very stubborn. It tends to be the last piece of fat that men lose if they're trying to lose weight, and that's the perfect situation where liposuction would be applicable when we're aiming for a specific area of fat that just doesn't want to go away on its own through normal means of weight loss. So we use a normal tumescent technique where we inject tumescent fluid into the area we're aiming to remove the fat from. The medicines in this tumescent fluid accomplish a few different things. One, the numbing medicine in the tumescent fluid makes the pain during and after the procedure non-existent. And then the epinephrine in the fluid also takes care of any small amount of bleeding that you might encounter in the middle of the procedure. So we inject the tumescent fluid. We remove the fat with a cannula, a tube with a hole on the end of it, connected to suction. And over the course of an hour, we remove the amount of fat that we feel is necessary to achieve the contours you are looking for. And then over the next few days, the swelling from the surgery dissipates. And then over the weeks following that, the skin contracts down to fit the new form of tissue underneath. The recovery is very tolerable. Most people I tell they're going to return to normal in about 1 to 2 weeks. If I tell you to take any more time than that, you're going to be sitting bored at home and you're going to be wishing that you hadn't taken so much time off. The complications are pretty minimal. The incisions we use are normally less than 1 inch, so by the time they heal, you can find them if you look for them, but they're going to be very difficult to notice unless you're specifically looking for scars. So that's liposuction for men in a nutshell. Thank you so much for watching my video. Consults are free. Come talk to me more about this if you have any questions specifically, and we can figure out exactly what I can do for you to help you achieve your cosmetics goals. One more time, I'm Dr. Sistare with Palm Beach Cosmetic Surgery. Thank you so much.